Visit the city's website at TorranceCA.GOV. Most people assume that strokes occur only in older people, but surprisingly, they can happen at any age and at any time. Reporter Carranza finds out what can bring on this medical emergency.
On Wednesday, Rosa felt her hand go numb. The following day, she started to feel more numbness on one side of her face. By Saturday, she lost control of her reflexes.
I thought it was because of work. I thought for my age, why would I get a heart attack or something like that? I never thought that could be. Never expected it.
One of the myths about having a stroke is that it doesn't happen to young people, when in fact 1 out of 10 people who have a stroke are under the age of 45.
With the help of her doctor, Rosa began to understand the factors that contributed to her stroke.
Her cholesterol was high, she has this clotting disorder that she was not aware of, and she was wearing a birth control patch, which we know is a risk factor for the formation of blood clots.
The factors for stroke in young adults are different from those in older adults.
In younger people, we look at autoimmune disorders such as lupus or juvenile rheumatoid arthritis. We look for clotting disorders. We also look for cardiac abnormalities, an irregular heartbeat.
A stroke is basically an interruption of blood supply to any part of the brain and is sometimes called brain attack. Hypertension remains the #1 risk factor for strokes. Other factors are diabetes, family history, heart disease, and high cholesterol. Certain medications increase the chances of blood clots and therefore the chances of suffering a stroke. How do you know you're having a stroke? Dr. Amin explains.
We like to use an acronym called ACT FAST. Okay, ACT means just act. FAST stands for facial asymmetries. So if you look at somebody's face and they have a droop, or if you look in the mirror and you don't feel quite right. Arms, you can have somebody raise their arms and see if that one falls away or drifts or one side's weaker than the other. The S stands for speech. Does somebody's speech sound coherent or is it a little slurred? The T stands for time. FAST, time. Time is critical. If you see somebody with those symptoms or you recognize those symptoms in yourself, you need to get to the nearest emergency room immediately.
Rosa has made a full recovery. She eats healthier than she did before and even quit smoking.
I would tell young people to watch their eating habits, to get checkups, check their blood and their cholesterol. And if it's a little high, to try to keep it at a normal level because you can get a scare like this.
Whatever your age, if you're experiencing stroke symptoms, the faster you get diagnosed, the better your chances for recovery. For City Cable 3, I'm Carranza.
Thanks, Anna. Remember, a stroke is a medical emergency. Immediate treatment can save lives and reduce disability. Call 911 or seek immediate medical attention at the first signs of stroke.